Hi.
Action.
Hi, welcome to Farnham Pilates. My name's Hannah and today we're going to be looking at back mobility and just working on your core a little bit and mobilise upper back into the waist and into the lower back. So what I want you to do is really think about standing with a neutral alignment. It's a nice relaxed posture. So weight over the ankles, knees and hip bones. Lift up through the spine and just gently roll the shoulders back. With the shoulders nice and relaxed down, I want you to put your hands on your rib cage. Breathe wide and full, so in through your nose, into that rib cage, nice wide and full, and breathe out through your mouth. So you're expanding the rib cage, not into the chest, not into the belly. Breathe in and breathe out. Just imagine your rib cage is like bellows. Okay, good. On your next out breath, I want you to gently lift the pelvic floor as if you were stopping yourself from going to the loo. You're lifting all the way up as tight as you can and then slowly release all the way down. Breathe in, lift up halfway and then release. And breathe in and lift up to a low level, so about 30% with the pelvic floor. Good. Now just a little bit more mobilising the shoulders and then taking both shoulders up and round. All the time you're keeping that pelvic floor nice and relaxed, lifted up to that 30%, so not a full squeeze. You're still breathing nice and wide and full, mobilising the shoulders. Just do a couple more times. Good. Once your shoulders are relaxed, then I want you to think about the head and neck. Roll the head from side to side. Just nice little general warm up to make sure your body is nice and warm. Good. Head back, coming back to the centre. Then going into a little spine twist, mobilising and stretching in the back. You can do these warm-up exercise in the morning just to try and get the spine stretched after your night's sleep. Good. Couple more times on your own and then going into a little side bend. If you have very bad lower back, then I would place your hands on your hips and just little lateral side bend from side to side. Good. Okay, so again, if I didn't introduce myself properly, my name's Hannah Epps and I work for Farnham Pilates. Good. Coming back to the centre, shoulders nice and relaxed. When you're ready, we're going to go into a nice gentle roll down. Lift up through the spine, draw those tummy muscles in, lift that pelvic floor. On your out breath, drop your chin to chest and slowly roll down. As if you're rolling in yourself as if you're a snail. So curling down, stretch all the way down towards your knees and then down to your feet. Knees are nice and soft and gently roll up. Okay, just do a couple more times on your own, and as you go down I want you to be aware of any strain or pain in the back. Hands can walk along the legs if you need, but go all the way down, relax the arms and then slowly curl up. Breathe in. Okay, I'm just going to do this one, but you can carry on and do a couple more if you want. Roll down and then bring yourself down onto your hands and knees. Good. Shoulders nice and relaxed. When you go into an exercise called thread the needle, mobilising across the upper back. Breathe in and breathe out. Thread the left hand under the right shoulder, twisting and opening out in your upper back, the rhomboids, stretching in the lats across the back. Breathe in, again, engage that pelvic floor, gently lift the belly button, release your right hand and stretch through the other side. Good. Breathing in, come back, think about your breathing. And breathe out, thread the other way. Just warming it, still thinking about warming up the back, slowly going a little bit further each time. In theory, I want you to do 3, 4 more each side. If you want to go a little bit more, you can go all the way down and shoulder down and stretch through, stretching into that lower back here as well. Good, lifting up and same the other side. And as I said, if you want to, pause the video and do a few more. Stretching through the back, think about the cat stretch. So I want you to drop the head down, lift the shoulders, curl through the back, drop the hips forward, squeeze the belly button, hold. And then as you release, go bit by bit. Head, neck, shoulder, so to make sure you don't emphasise one part of the back. Mid-back, lower back, release back into neutral. One more time, drop the head. Lift the shoulders, curl through the back, hips forward, hold that position, go into a little cow. It's called cow stretch. Twist your hips to the right, head to the right. Twist your hips to the left, head to the left. Nice stretch on the lower back. Release all the way down and push yourself back into the child pose. Stretch the arms out in front. Nice stretch in the shoulders and across the back. Relax the head. If you want to, take the arms slightly wider and push the shoulders down. Okay, breathe wide and full. Now tuck the head in, hands to your feet. Slowly roll up through the spine and roll the shoulders nice and relaxed. Bring yourself all the way down to the front, onto your front, into a prone position. I want you to really get a nice little stretch in the lower back. Gently place the hands down. Lift the right foot and take the right foot across the hip and get a stretch. Now your aim is to keep the elbows down and just lift as high as you can, what's comfortable for you, and take the foot across. If you can, take the toe down. If not, don't worry. Just nice little release in the lower back and change sides. Lift the head, push that elbow down and take the foot the other side. Sorry, my reformer is in the way. And slowly release back. Shoulders nice and relaxed. Okay, working the glutes that support the back. Breathe in. Lift that pelvic floor again. Gently tuck your bottom down. You can put a little pillow under there, but make sure you're not arching the lower back. No pressure on the lower back. Squeeze your glute on the right, on your buttock. Lift the right leg and lower and change sides. Squeeze the left side and lower and lift. Your head and hands are relaxed. Your shoulders are relaxed. Breathe out, lift. Breathe in, lower. Breathe out, lift. Breathe in, lower. Good. Breathe out, lift. Breathe in, lower. Breathe out, lift. Breathe in, lower. Okay, keep going. 10 more each side. Shoulders nice and relaxed. I'm just going to do a couple more to work in the back. So I'm going to bring myself back into a seated position, roll my shoulders back and down, and then I'm going to take myself down onto the back. So just 2 more. Bring yourself slowly down, nice, and protect the back. If there's any problems with the lower back, come slowly onto your side and then bring yourself down. Feet hip width apart, shoulders nice and relaxed, chest open. Going into the shoulder bridge, again, there's mobility for the back. So you're going to breathe in, breathing out. Shoulders nice and relaxed down. As you breathe out, your pelvic floor is lifted. You go into little pelvic tilts. You're lifting your hips. You're squeezing the bottom as soon as you can, so there's no pressure on the hamstrings, and slowly curl up. Breathing out as you curl up and breathing in as you curl down. Nice relaxed movement. In yoga, people might take it a little bit too high. Just really be aware there's no pressure in the lower back. You want to come up to a ski jump position, knees, hips, shoulders in alignment. If you have a very tight lower back, you might need the feet wider as you roll up, so it's less pressure on the back and the hips. You just got to be aware that your feet are parallel and nice relaxed position. Okay, just want you to do 4 or 5, roll up, breathe out, breathe in and lower. Really try and articulate through the spine, roll all the way down. You probably can't see with my black top, but I want you to lift up vertebrae over vertebrae as if it's like a pearl necklace, link by link by link, and then roll down. Ribs, mid-back, lower back, and release back into neutral. Good. Just 2 more on your own, and then when you're ready, we're going to do sort of a hip twist, feet together, knees together. You take the knees to the side, stretch in the lower back. I'm trying to keep my right shoulder down and the knees go down as far as you can. Pull the belly button in and bring yourself back to the centre. Pelvic floor and over to the other side. Keep the neck nice and relaxed. If you have any neck issues, then you can turn the head the other way. Just get a nice little stretch into the neck. Just take it nice, comfortable. Do a few either side. And then when you're ready, come back in. And nice hug with the legs. Thank you very much. I hope that relieves any problems on the back. Okay. Thank you very much. That was Hannah Epps from Back Care Pilates. Hope to see you again soon.
Very nice.